This medication is used to treat minor pain, itching, swelling, and discomfort caused by hemorrhoids and other problems of the anal area, such as anal fissures and itching. It contains pramoxine, an anesthetic that works by temporarily numbing the area, and hydrocortisone, a corticosteroid that reduces redness, itching, and swelling. It is usually applied to the affected area 3 to 4 times daily, or as directed by your doctor. It is best to use this medication at the same times each day to help you remember. Apply a thin layer to the affected area and rub in gently. Do not cover the area with bandages or other dressings unless directed by your doctor. Before using Analpram-Hc 1% to 1% rectal cream, make sure to clean the affected area with mild soap and water, rinse well, and pat dry. To apply the cream inside the anus, use the applicator tip or cap as directed, or follow your doctor's instructions. Gently insert the applicator tip just 1/2 to 1 inch inside the anus and apply in and around the anal opening as directed. Do not insert your finger or any part of the container into the anus, and do not insert the applicator tip more than 1/2 to 1 inch inside the anus. If you are using a single-use tube and applicator, discard after one use. For application to the outside of the anus only, apply a small amount to the affected area and rub in gently. Do not cover the area with plastic or waterproof bandages unless directed by your doctor. This may increase the absorption of the medication through the skin, which can improve how well the drug works but can also increase the risk of side effects. After use, wash hands immediately. Avoid getting the cream in your eyes, nose, ears, or mouth. If the medication gets in these areas, rinse immediately with clean water. Some brands come with wipes. Use the wipes as directed before applying the medication. The wipes are usually flushable, so discard them in the toilet after use. Use this product as directed by your doctor, usually 3 to 4 times daily, or after each bowel movement. The dosage is based on your medical condition and response to treatment. Use it regularly to get the most benefit. To help you remember, use it at the same times each day. Do not use more than prescribed, use it more often, or use it longer than prescribed. If you have been using this medication for a long time or in high doses, do not stop using it suddenly without your doctor's approval. Some conditions may worsen when the drug is suddenly stopped. Your dose may need to be gradually decreased. Inform your doctor if your condition does not improve or if it worsens after 1 to 2 weeks. Some common side effects of using Analpram-Hc 1% to 1% rectal cream may include redness, burning, or itching at the application site. If any of these effects persist or worsen, it's important to contact your doctor or pharmacist promptly. It's worth noting that your doctor has prescribed this medication because they believe the benefits to you outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's important to seek medical attention if you experience any serious side effects, such as rectal bleeding, changes in skin appearance, skin redness, tenderness, pus, or signs of infection, or signs of a serious infection, like a persistent sore throat or fever. In rare cases, this medication can be absorbed into the bloodstream, potentially leading to side effects from too much corticosteroid. These side effects are more likely in children and those who use the medication for a long time. It's essential to inform your doctor immediately if you experience unusual fatigue, weight loss, headache, swelling of the ankles or feet, increased thirst or urination, or vision problems. Although it's rare, a very serious allergic reaction to this drug can occur. If you notice any symptoms of a serious allergic reaction, such as rash, itching, swelling, severe dizziness, or difficulty breathing, seek medical help right away. This is not an exhaustive list of potential side effects, so if you notice any other effects not mentioned here, it's important to contact your doctor or pharmacist for further guidance. Additionally, you may report any side effects to the relevant health authority in your country. Before using Analpram-Hc 1% to 1% rectal cream, make sure to inform your doctor or pharmacist if you are allergic to pramoxine or hydrocortisone, or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems. Also, it's important to discuss your medical history with your doctor or pharmacist, especially if you have diabetes, eye problems, infections, especially rectal sores/infections, liver disease, or stomach/intestinal problems. Using corticosteroid medications for a long time can make it more difficult for your body to respond to physical stress. If you have surgery or emergency treatment, or if you experience a serious illness or injury, be sure to inform your doctor or dentist that you are using this medication or have used it in the past few months. If this medication is used for a long time in children, it may temporarily slow down their growth. Make sure to regularly see the doctor so your child's height can be checked. For pregnant women, this medication should only be used when clearly needed and not for long periods of time or in large amounts. It's important to discuss the risks and benefits with your doctor. Consult your doctor before using this medication if you are breastfeeding, as it is unknown if this medication passes into breast milk. It's important to be aware that using Analpram-Hc 1% to 1% rectal cream may interact with other medications, potentially affecting how they work or increasing your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without first obtaining your doctor's approval. This will ensure the best and safest outcome for your treatment. If swallowed, Analpram-Hc 1% to 1% rectal cream may be harmful and cause serious symptoms such as passing out or trouble breathing. In case of overdose, it is important to seek immediate medical attention by calling 911 or contacting a poison control center. U.S. residents can call their local poison control center at 1-800-222-1222, while Canada residents can call a provincial poison control center. It is important to keep this medication out of reach of children and pets to prevent accidental ingestion. Remember to store it at room temperature and avoid exposing it to excessive heat or moisture. It's important not to share this medication with others. Your doctor may also want to perform lab or medical tests, such as checking your cortisol levels, while you are using this medication. Be sure to attend all of your medical and lab appointments. Remember, this medication has been prescribed specifically for your current condition, so don't use it later for another condition unless your doctor tells you to do so. If you need a different medication for a new condition, your doctor will provide the necessary guidance. If you forget to use the cream at the scheduled time, you can use it as soon as you remember. However, if it's almost time for your next dose, it's best to skip the missed dose and just use the cream at your regular time. Don't use a double dose to make up for the missed one. It's important to store Analpram-Hc 1% to 1% rectal cream at room temperature, away from light and moisture. Avoid refrigerating it and keep it out of reach of children and pets. When it's expired or no longer needed, make sure to properly discard the product. You can consult your pharmacist or local waste disposal company for guidance on how to do this. Remember not to flush this medication down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.